tell you about a particular patient that I'm thinking of at this particular point. Again, I've seen patients in the adult spectrum from 18 years old to 108 years old, if you will. And I can remember how rewarding it was. One particular woman that I took care of, she was in her early 80s, and when I really took the time to get to know my patient, she had severe arthritis of both knees that was really limiting her ability to enjoy her life. So I said to her, what makes you enjoy your life? And she said, you know what it is? It's my grandchildren, and it's going to our church social, which has dancing. I think it was once a month, and I can't do that anymore, and that's really affecting my life. And so, we really went over what types of things she could do. This lady, because she was older, would be at risk for taking some non-opioid medications. Non-steroidal anti-inflammatory agents are very often used to treat people with osteoarthritis. They're really great medications to use short-term. This woman was older, it wouldn't have been a good medication choice to her. So in any event, I suggested to her that she might do well on a low-dose opioid medication, and then also figuring out how she could go to her church dances with perhaps doing some activities, some dancing, and then resting, and then dancing some more. So we tried her on this medication. She was a little reluctant to do so. I called her back after a week and asked her how she was feeling, and she said, I'm really feeling good. I'm feeling good. She was not, her thinking was not impaired. She wasn't dizzy. These are the kinds of things that I look for with older people. So, we brought her back in. We got the medication where it should be, and then we said, how are we going to focus on this activity for you? How are we going to get you back to your dancing? And so we put her on an activity pacing schedule. I said to her, why don't you try going to your dance and dancing one dance? And then sitting and resting and trying it again. And so her joy when she came back after about 2 months, seeing me and going to one of these dances, and she said, I hadn't danced in years. And I took that medication before I went to the dance, and I tried what you said. I tried to dance a little bit, I had some fun, I sat down and I enjoyed some company with some other people, and I got up and did it again, and she had not done that in years. So, again, it's really how you can help to prepare your patients, to educate them, to know them, to find out, what's really important to them in order to deliver good pain care and improve people's quality of life.
Excellent. Thank you, dear.
Okay.
Super.